Welcome to Peptide-Proof, your source for rigorous, independent, evidence-based peptide intelligence. Today we're looking at Syn-Ake, the Viper Venom peptide that rewrites muscle signaling.
Syn-Ake definitely isn't your standard skincare ingredients. It's actually a synthetic tripeptide designed specifically to competitively block acetylcholine right at the neuromuscular receptor. What that means for you in practical terms is that it's engineered to reduce those stubborn, static expression lines on your face, but it manages to do it without completely freezing your natural facial dynamics. Let's take a look at where this compound actually comes from. The origin story here is honestly fascinating. Back in 1933, researchers were looking at the temple viper. Its venom doesn't actually destroy tissue. Instead, it paralyzes prey by completely shutting down synapse signaling. Decades later, scientists managed to isolate the specific 22 amino acid polypeptide responsible for this, a little something called Waglerin-1. But obviously we can't just drop raw snake venom into an anti-aging serum, so chemists synthesized a much smaller, safer biomimetic version. That's Syn-Ake. It safely and reversibly replicates that exact same receptor binding behavior. To really grasp how Syn-Ake pulls this off, we need to map out the neuromuscular landscape. Think about every time you furrow your brow or squint. A motor neuron on the presynaptic side releases a signaling neurotransmitter, acetylcholine, right into the synaptic gap. That acetylcholine travels across and docks onto nicotinic receptors on the muscle cell, which is the postsynaptic side. When it docks, ion channels open up, sodium floods in, and the muscle contracts. When you repeat that over years, it's exactly what drives the formation of facial lines. Now, this is where things get really interesting, especially when we compare two major players in the space, Argireline and Syn-Ake. They take fundamentally different paths to relaxation. Argireline takes the presynaptic approach. It competes for the SNARE protein complex inside the nerve terminal, which basically stops the acetylcholine vesicles from ever fusing and releasing. It's like it stops the key from even being made. Syn-Ake, on the other hand, skips the nerve entirely. It goes for a postsynaptic approach, binding directly to the nicotinic receptor on the muscle fiber itself. So the acetylcholine is still released, but Syn-Ake has essentially changed the lock, so the key no longer fits. If they zoom in on this receptor-level antagonism, the real secret weapon is the benzylamide group at its C-terminus. This group acts like an anchor, slipping right into the acetylcholine binding pocket, using hydrophobic interactions and hydrogen bonds. But here is the crucial part. This is a reversible competition. It physically blocks the docking, sure, but because it's not some irreversible enzymatic blocker, it just naturally diffuses away over time. The end result is a gentle softening of your expression lines that still lets you maintain your natural facial expressions. So you might be wondering, does it actually stay put in the receptor? While molecular dynamic simulations from a 2024 study show that Syn-Ake remains completely stable in the receptor site for a full 50 nanoseconds, it doesn't just wobble out. Interestingly, this docking data also hypothesizes that Syn-Ake might inhibit MMP13. That's the collagenase enzyme most strongly linked to photoaging, which suggests it could actually protect your dermal matrix from breaking down. On top of that, the safety profile is highly favorable. It easily cleared cytotoxicity and Ames genotoxicity assays, meaning it's non-toxic and non-mutagenic, all while showing some secondary antioxidant capacity. Let's bring this into the real world with some clinical data. A landmark 2026 study published by L'Oreal in the International Journal of Cosmetic Science ran a 12-week trial. But look closely at the formula they used. They didn't just test Syn-Ake in isolation. They combined it with Argireline for that presynaptic blockade, niacinamide for barrier support, and gluconolactone for penetration and exfoliation. This setup is really testing the absolute ceiling of what these neurotransmitter-inhibiting peptides can achieve when they're formulated with synergistic actives.
Beyond the headlines.
Into the research. Peptide-proof.
And the results from that study? They're compelling. We're talking about a 35 to 69% improvement in static wrinkles. That reached statistical significance and showed visible improvement in just the very first week. Dynamic wrinkles, which are driven by expression and are notoriously tough to suppress topically, saw a modest but mechanistically sound 10 to 13% reduction. But don't overlook the secondary benefits. Ex vivo biomarker analysis confirmed that visible improvements in firmness, elasticity, and pore appearance actually correspond with deep biological changes. Specifically, they saw increased levels of multiple collagen types and a noticeable decrease in MMP1 expression. However, all of that clinical data doesn't mean much if the peptide can't actually get into your skin. You've probably heard of the 500 Dalton rule. Basically, the stratum corneum fiercely repels molecules larger than 500 Daltons. Now, Syn-Ake sits comfortably in the mid-300 Daltons, so technically it's small enough for passive diffusion. But size isn't the only variable here. Charge and hydrophilicity matter just as much. To actually reach the dermis, it requires an effective delivery system. A great example of this is the 2024 NanoGlow exosome study, which proved that encapsulating peptides in plant-derived nanoscale vesicles successfully shuttles them deep into the dermal layer. Which brings us to the critical traps that expert formulators need to avoid. First up is the expectation trap. As a consumer, you shouldn't expect enzymatic, Botox-level paralysis from a topical serum. Syn-Ake's real value is in gentle, movement-preserving softening. Second is the pH trap.
Syn-Ake's benzolamide moiety is highly susceptible to hydrolysis, which means your serum has to maintain a strict pH between 4.5 and 6.0. You definitely don't want to combine it with harsh exfoliating acids. And third, the concentration trap. In this case, more peptide does not equal more relaxation. The sweet spot strictly sits in the low single-digit percentage range. If you use too much, you risk receptor desensitization, where the muscle cell just completely downregulates nicotinic receptors in response to the chronic antagonism.
So how should you actually apply this? Well, Syn-Ake makes the most sense as a highly targeted treatment. It needs to be applied strictly over the thin, superficial muscles where contractions create expression lines in the first place. Think your forehead and crow's feet. For building out a routine, it synergizes perfectly with presynaptic peptides like Argireline, letting you shut down the entire neuromuscular cascade from both ends. And since Syn-Ake doesn't do anything for gravitational sagging, pairing it with a matrix-building matrikine like Matrixel is a very smart move. That way, you're halting the dynamic muscle folding while simultaneously rebuilding the underlying collagen architecture.
To wrap things up, that is your ideal Syn-Ake blueprint, from its direct postsynaptic blockade mechanism right through to strict formulation rules and targeted routine synergy. It leaves us with a pretty fascinating question to consider. As topical peptides become increasingly sophisticated, will biomimetics like Syn-Ake eventually replace injectables entirely, or are they just destined to become their ultimate daily companion? That's all for this episode. Like and comment to receive materials from us. Thanks for watching, and we'll see you next time.